A look at your coronavirus headlines for this Monday evening. Governor Charlie Baker today issuing a stay-at-home advisory effective tomorrow until Tuesday, April 7th. The governor also ordered the closure of all non-essential businesses starting at noon tomorrow. The number of deaths in the state is now at 9. That's up from 5 deaths yesterday. And the coronavirus is postponing the 2020 Olympic Games in Tokyo. More coverage on that outbreak momentarily. But first, we begin with the first warning weather day as snow has fallen for a good part of the day all across the region. Welcome to Western Mass News at 6. I'm Beth Ward. Chris is off tonight. All right, the big question is, what can we expect moving forward? When is this going to end? I saw some sleet a little bit earlier in Springfield.
There's some rain falling as well.
Yeah.
There's snow falling north and west of town. So as we go into the coming hours, we will see some eventual changing over. If it hasn't changed over to rain for you, it likely will, unless you live in Franklin County or northern Berkshire County. That's where we expect the cold air to just stay. So this is a long duration snow event for those areas. So looking at our radar, we do have a lot of blue showing up, but that's not really indicative of what's actually falling to the ground. We do have some sleet showing up, at least in Springfield. I do think the only place right now that we're really seeing all snow is through Franklin County. Some heavier bands through Greenfield into Sunderland, out towards South Deerfield as well, and then into northern Berkshire County. But down to the south, this is mainly sleet and rain falling, despite the fact that the radar showing up as blue snow. We do have the back edge of the storm that will swing through as we go into the later evening and into early Tuesday. Before this does, we're going to pick up a solid coating and much more into the Berkshires. We're at 33 in Springfield, 35 in Hartford, and 30 degrees in Worcester. The roads are definitely covered, many side roads kind of treacherous. Watch as Futurecast shows this wrapping up and leaving us by the time we get into very early Tuesday, leaving us with some partly cloudy skies into tomorrow. Full look at the forecast as we look at that coming up in just a few minutes. Beth, back to you.
All right, Jacob, thank you. Now to the latest on our coronavirus coverage. 9 deaths now reported due to the virus here in the Bay State. The state's Department of Health reports 777 cases, the highest number in Middlesex County with 232. In Western Mass, the state has confirmed 15 cases in Hampden County, 6 in Hampshire, and 2 cases in Franklin County. Berkshire County reporting 26. Well, the governor announcing the closure of all non-essential businesses in the state and is asking everyone to stay in their homes as much as possible. This comes as efforts to research the virus here in Massachusetts are being stepped up. Western Mass News reporter Audrey Russo joins us now live in Springfield with more. Audrey?
All non-essential businesses will be closed for 2 weeks starting tomorrow at noon. But healthcare workers who are deemed essential are continuing to work across the state to make sure cases of coronavirus are tested, tracked, reported accurately, and most importantly, researched.
We need to ensure that our commercial labs also report not just the positives, which they're required to, but also the total number of people that they're testing so that we have a good sense in Massachusetts, right, how many people are tested as well as how many are positives.
Testing, tracing, and isolation is the state's plan for understanding and stopping coronavirus. Governor Charlie Baker announcing that all non-essential businesses, excluding those listed here, must close Tuesday at noon. The Secretary of Health and Human Services asking for help from healthcare students, many of whom had their in-person classes canceled.
There was a call with the deans of the schools of public health in Massachusetts to see if we can use their they're not in school, use their students and others that are engaged with the public health community to help us do tracing.
Closer to home, Western Mass News spoke over video chat to Dr. Peter Friedman. He is the Chief Research Officer at Bay State Health, although he says a lot of research into different healthcare challenges has been slowed by social distancing guidelines.
Many studies require written consent, and you can't get written consent virtually.
Meanwhile, in the fight against COVID-19, Friedman says Bay State is working steadily on researching the virus and how it affects local patients.
What kinds of outcomes they will have as a result of the virus, but also clinical trials of promising medications. We also have our research folks engaged in trying to get compassionate use of some of these agents.
Friedman says one of the biggest questions he gets as a researcher is on the length of time it will take to develop a safe and effective vaccine.
If we get a vaccine in a year and a half, that would probably be a record. It would be incredibly fast.
And per the governor's guidelines announced today, Dr. Friedman reiterated the importance of social distancing and these social distancing rules. He says that everybody should also be washing their hands no matter what. And if the 20 seconds or singing happy birthday twice benchmark isn't working for you or you're not able to visualize it, he says everybody should be washing their hands as though they just cut and handled fresh jalapeno peppers and now have to change their contact lenses. So obviously you're not going to give just a cursory rinse there, but you're actually going to wash and scrub. So keep that in mind more than anything else. Reporting live here in Springfield, Audrey Russo for Western Mass News.
I like that analogy. All right, Audrey, thank you. New at 6, Chicopee reports its first 2 confirmed cases of the coronavirus. Chicopee leaders made the announcement late this afternoon at City Hall. They say the 2 residents are recovering at home. City leaders stressing that they are always available for the public for more information.
With each case confirmed, we are identifying potential contacts and their risk of exposure and recommend appropriate public health and medical measures. At this time, I'd like to
Chicopee officials stress the importance of trying to flatten the curve with COVID-19 cases. They say residents should continue to follow the governor's orders as well as practice social distancing. And in Springfield, the Hampden County Hall of Justice is closed for the rest of the week. Hampden Superior Court Clerk Laura Gentile tells Western Mass News that one of the court officers has tested positive for COVID-19. She says everyone was told at 3:30 this afternoon and they were ordered to leave the building by 4 p.m. Gentile says the officer has been home sick since March 13th. The courthouse will remain closed until next Monday, we're told, so the building can be properly cleaned. Our team coverage on the coronavirus continues. We turn now to the Springfield Police and Fire Departments, where they are taking all precautions against the spread of COVID-19. Western Mass News reporter Sarah Granelli getting answers from city leaders about how they continue to protect the community during this outbreak. Sarah?
Beth, we spoke with the police and fire commissioners today, and they said they are ready to respond no matter what. As the coronavirus continues to ramp up across the state and in Western Mass, the Springfield Fire and Police Departments are making sure community members and their staff are safe.
We have all the necessary protective equipment. We have the N95 masks, we have the suits, we have the eye protection. But what we need from the public is if you are feeling ill and you have COVID-19 type symptoms, you need to let us know that you have these symptoms so we can be ready before we get there.
Western Mass News spoke with Springfield Fire Commissioner B.J. Calvi. He tells Western Mass News what you should do if you think you need help.
If you have been diagnosed with COVID-19 and need additional assistance from 911, you need to let the dispatcher know that you've been diagnosed with COVID-19. That way we can make sure we are ready when we get there. We've got the suits on, we've got the glasses on, we've got the masks on, so that we're ready to go and can protect ourselves as well as help you at the same time.
He says during these trying times, it's important to stay focused on fire safety at home.
I'd like everybody just to practice good fire safety. Everybody's at home now, so make sure you're shutting off your stoves, you're disposing of cigarettes appropriately, you're being careful with candles, and that you're taking all the necessary precautions.
The message from Springfield Police Commissioner Cheryl Clapprood. She tells Western Mass News it's important for community members to continue to follow the law.
Just know that it adds extra stress on the officers now if they're going to start disobeying these closures. We don't want to be out there enforcing, telling people, you know, you have to shut down and there's too many of you in one spot. If people obey it and help us out in the long run, it'll make everything go a lot smoother.
She says her department is stacked with extra police officers, and they are prepared to respond no matter what.
We are going to enforce all the laws as we usually do. I don't think that now is the time to relax anything. I think now is the time to make people feel safe.
The Springfield Police and Fire Department both say to give them a heads up if you have corona-like symptoms and they're heading to your house. Live in Springfield, Sarah Granelli, Western Mass News.
Sarah, thank you. As many of us rely more and more on delivery services like Amazon during this coronavirus pandemic, it raises the question of safety. How long can COVID-19 live on surfaces like packaging? Should we wipe down our mail or our groceries? Tonight, we get answers from Mercy Medical Center's Chief Medical Officer. Scientists are learning new things about the coronavirus each day. Let's start with what we do know.
What we do know about this novel coronavirus is that it's typically spread by droplets that come from the coughs and the sneezes, bigger particles that then are either breathed in or they land somewhere we touch our eyes, nose, or mouth.
But how long does the virus last on things like grocery bags or packages? Scientists at the National Institutes of Health say this: droplets can last 3 hours in the air, 4 hours on copper, 24 hours on cardboard, stainless steel 48 hours, and plastic 72 hours. However, Mercy Medical Center's Chief Medical Officer, Dr. Robert Roos, tells Western Mass News the actual amount left behind, researchers found, was minuscule.
It showed that very, very, very small percentages could still be alive on a surface for over 24 hours, maybe even longer, but that's less than 0.1% of the amount of virus that was originally put there, and there's no evidence to suggest that that could actually be transmitted and create the level of burden that would cause an infection.
In other words, he says, likely not enough to make a person sick. Some have suggested wiping down groceries or leaving a package or your mail out, for example, in really hot or cold temperatures for 24 hours. Dr. Roos suggests use common sense.
Wash your hands. If you pick up your package, wash your hands before you might, touch your eyes or your mouth or your nose, but not necessarily doing things like leaving it in extreme temperatures or things like that.
And don't panic.
I would say in this type of case, I don't want to create panic about all these different areas. Certainly if there's a transport of a package over many, many hours or even days, the likelihood that there would be enough of a virus on that surface that would cause an infection, I think, is very low.
The World Health Organization says it is safe to receive packages from any area, that the likelihood of an infected person contaminating commercial goods is very low, and the risk of catching the virus from a package that's been moved, traveled, and exposed to different conditions and temperatures is also very low. Well, right now at this hour, President Trump is giving his daily briefing on the coronavirus. Let's listen in.
It will end soon. Normal life will return, and our economy will rebound very, very strongly. But right now, in the midst of this great national trial, Americans must remain united in purpose and focused on victory. To every single American, please know that the sacrifice you're making at this time is saving lives, many, many lives. It's very important that we totally protect our Asian American community in the United States and all around the world. They're amazing people, and the spreading of the virus is not their fault in any way, shape, or form. They're working closely with us to get rid of it. We will prevail together. It's very important. From the beginning, we have been working closely with our nation's best scientists and medical professionals, and we will continue to do so until we have defeated the virus. Our public health experts, who are terrific, are studying the variation in the disease across the country, and we will be using data to recommend new protocols to allow local economies to cautiously resume their activity at the appropriate time. We also have a large team working on what the next steps will be once the medical community gives a region the okay, meaning the okay to get going, to get back, let's go to work. Our country wasn't built to be shut down. This is not a country that was built for this. It was not built to be shut down. My administration continues to work with Democrats and Republicans to reach an agreement on an urgent relief bill for the millions of American workers and small businesses and large businesses that were badly affected by the medical difficulty that we've had. If you had a viable business in January, we are committed to ensuring the same is true in the coming weeks. In fact, we want to make it even better than it was before, and we're doing things to help in that regard. America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting, a lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem. At the end of the 15-day period, we'll make a decision as to which way we want to go, where we want to go, the timing, and essentially we're referring to the timing of the opening, essentially the opening of our country. because we have it pretty well shut down in order to get rid of this invisible enemy. 2 weeks ago, we moved at record speed to pass paid sick leave and paid family medical leave and approved $8 billion, including money for the development of treatments and vaccines. And we're doing tremendous work on both fronts. The vaccines are coming along very quickly. Now Congress must demonstrate the same bipartisanship again and join together to pass the Senate bill as written and avoid playing any more partisan games. They have to get together and just stop with the partisan politics. And I think that's happening. I got a call a little while ago. I guess they're getting closer. It should go quickly. And it must go quickly. It's not really a choice. They don't have a choice. They have to make a deal. This should not be a time for political agendas, but rather one for focusing solely and squarely on the needs of the American people. We are going to save American workers, and we're going to save them quickly. And we're going to save our great American companies, both small and large. This was a medical problem. We are not going to let it turn into a long-lasting financial problem. Started out as a purely medical problem, and it's not going to go beyond that. We're just not going to allow that to happen. Our country was at its strongest financial point. We've never had an economy like we had just a few weeks ago, and then it got hit with something that nobody could have ever thought possible. And we are fixing it. We're fixing it quickly. And I want to just thank the American people for what they've been through and what they're doing. Our country will be stronger than ever before, and we fully anticipate that, and it won't be that long. Let me provide you with an update on critical supplies. FEMA is distributing 8 million N95 respirator masks and 13.3 million surgical masks across the country right now. Focusing on the areas with the greatest need, we've shipped 73 pallets of personal protective equipment to New York City and 36 pallets to the state of Washington. In the past 96 hours, FEMA has also received donations of approximately 6.5 million masks. We're having millions and millions of masks made as we speak, and other personal protective equipment, which we will be distributing to medical hotspots. We're focused on some of the hotspots. Across the nation, we're seeing an outpouring of creativity and innovative ideas widely shared between the federal health leaders, governors, and mayors, the scientific community, and members of the private sector. Really working together. Everybody's working together. I'm pleased to report that clinical trials in New York will begin existing for existing drugs that may prove effective against the virus. At my direction, the federal government is working to help obtain large quantities of chloroquine. And you can look from any standpoint tomorrow in New York. We think tomorrow pretty early, the hydroxychloroquine and the Z-Pak, I think, is a combination, probably is looking very, very good, and it's going to be distributed. We have 10,000 units going, and it'll be distributed tomorrow. It'll be available, and is now. They already have it. They're going to distribute it tomorrow morning to a lot of people in New York City and New York. We're studying it very closely, watching it very closely. You probably saw a couple of articles today came out where a gentleman, they thought he was not going to make it. He said goodbye to his family. They had given him the drug just a little while before, but he thought it was over. His family thought he was going to die. And a number of hours later, he woke up, felt good. Then he woke up again, and he felt really good, and he's in good shape. And he's very happy for this particular drug that we got approved in record-setting time. There's never been anything even close to it. And I want to thank the FDA, which has been incredible, and Dr. Hahn, Stephen Hahn, highly respected man, but they're doing everything possible to increase production and available supply of these drugs, not only this drug, but also others that are coming. Remdesivir is coming from Regeneron, A couple of others are also under study. But the one that I'm very excited about right now is the one we just mentioned. And I think there's a real chance. I mean, again, we don't know, but there's a real chance that it could have a tremendous impact. It would be a gift from God if that worked. It would be a big game changer. So we'll see. But distribution starts tomorrow morning early in New York, and I think a lot of people are going to be, hopefully they're going to be very happy with the result, but we're all going to be watching closely. It's something we have to try. It's been very, very successful in malaria, very, very successful. And countries with malaria have had a interesting thing happen. They take this particular drug. It's a very powerful drug. And there is very little semblance of the virus in those countries. And there are those that say because this drug is very prevalent because of the malaria. So we'll see what happens. I'm also announcing that we're postponing the deadline for compliance with real ID requirements at a time when we're asking Americans to maintain social distancing. We do want to require people to go with their local DMV. We will be announcing the new deadline very soon. It's going to be announced in a very short moment. Overnight, we successfully brought home 103 American citizens after they had been stranded for 10 days in Brazil. Following a cruise, we want to thank the Brazilian government and their great president. Most of those returned were senior citizens. My administration, in cooperation with Governor Greg Abbott of Texas and the private sector, coordinated their safe return to the United States. So thank you to Governor Abbott. Terrific governor, terrific man. Earlier today, I signed an executive order invoking presidential authority under Section 4512 of the Defense Production Act to prohibit the hoarding of vital medical equipment and supplies, such as hand sanitizers, face masks, and personal protective equipment. We have a lot of face masks, a lot of equipment is coming in, and we have some people hoarding. And Attorney General Barr is going to be speaking about that in a second. We want to prevent price gouging, and critical health and medical resources are going to be protected in every form. Under this directive, the Secretary of Health and Human Services is authorized to designate essential health and medical supplies as scarce. So he'll designate certain supplies and medical elements as scarce, and that means it will be a crime to stockpile these items in excessive quantities, which is happening to a relatively small degree, we think, but nevertheless it's happening. We can't let it happen. And we can't let them resell them at excessive prices, which some people are doing. Very simply, we will not allow anyone to exploit the suffering of American citizens for their own profit. So we're going to be watching that with our great Attorney General very closely. The Department of Justice will be aggressively prosecuting fraudulent schemes related to the pandemic. Yesterday, federal prosecutors took action in their first case, shutting down a website selling a totally fake vaccine, if you can believe that one. As president, I will always fight to protect Americans from being exploited. Thankfully, all throughout the country, we're witnessing extraordinary acts of compassion, benevolence, and unity. Construction companies are donating masks by the hundreds of thousands. Manufacturing workers are transforming their assembly lines. Citizens are volunteering to deliver food and medicine to the elderly. We're truly seeing America at its best. We're really seeing things that people never thought even could happen. Frankly, we never thought this could happen. But the way most Americans are working toward getting it solved and just doing what they have to do to make this go away has been incredible. It's been incredible. I want to take a moment to thank the everyday heroes who are making our vast effort against the virus possible. And thank you to the healthcare workers and the first responders. These are very brave people. Thanks also to the hardworking men and women of Federal Express, UPS, the United States Postal Service, and the truckers who are maintaining our supply chains and supply lines. We thank you very much. Great job. We also want to give our regards and thanks to everyone at our grocery stores working the night shift so that shelves can be restocked, and the restaurant workers and delivery drivers keeping our families fed. So many of these restaurants, it's incredible. They're doing service where people come and they pick it up, delivery. I mean, it's been incredible what they've been doing. Totally different business than they were in, other than they cook food. Other than that, it's like a totally different business. Most of all, I want to thank the American people for rising to the challenge and showing incredible courage, determination, patience, grace, and grit. From New York to Seattle and everywhere in between, your acts of selflessness and sacrifice and ingenuity are a powerful testament to the American character. It's really being shown. It's really showing up at a level that people are really respecting. All over the world, they're respecting. And the world has problems. We're at 148 countries now. 148 countries are affected by the invisible scourge. And all of the uplifting reflections of the American spirit are out there for everyone to see. Together, we will care for our fellow citizens, and we will win this war, and we'll win it much sooner than people think. And we'll be back in business as a country pretty soon. You'll be hearing about that also pretty soon. Now I'd like to ask Attorney General Bill Barr to say a few words, and we'll take questions in a little while. Thank you.
Let me start by thanking you, Mr. President, Mr. Vice President, for your decisive leadership in this unprecedented battle to save American lives. At the Department of Justice, we're working hard to protect the health and safety of our personnel while at the same time keeping our enforcement efforts at full throttle. So I'd like to thank all of my colleagues in law enforcement, not just those at the federal level, but of all our state and local partners, the police officers, the sheriff's deputies who are protecting.
You have been watching live coverage of President Trump's task force briefing on the coronavirus pandemic. The president saying that the United States will soon be open for business, not the 3 or 4 months that he says some have suggested. He also urged lawmakers to come together on a package to help businesses and families, and that FEMA is receiving millions of masks to help in this crisis. We, of course, will have more coverage on this coronavirus outbreak coming up on Western Mass News.